All right, y'all, we're on with Dr. Gary Blau, who is the Executive Director of the Hackett Center for Mental Health and the Meadows Mental Health Policy Institute in Houston. That's a mouthful, Dr. Blau. How are you?
I'm great, thank you. So just to clear, yes, I am the Executive Director of the Hackett Center for Mental Health in Houston. We are actually a regional program of the Meadows Mental Health Policy Institute, which is a statewide institute here in Texas based out of Dallas.
Very, very good. So there is so much to say about our mental health and our degree of self-care that we're able to, take the opportunity to take at this point. But let's start, though, with the organization OK to Say, which is what has brought you and I into contact with each other. Talk about OK to Say and what the mission is and how that's going.
Sure. Well, so first of all, OK to Say is an award-winning public awareness campaign that was initiated by the Meadows Mental Health Policy Institute and is supported here by the Hackett Center for Mental Health. And OK to Say's premise and message is very simple. That is that it's okay to talk openly about mental health. We really believe that that hope begins with open and honest conversations about mental health between trusted family members and friends and other loved ones, and that ultimately that together all of us can make a difference to ensure that everyone has the support that they need to get better if they're having a mental health challenge.
Very good. Talk about this. I mean, this is a very broad question, but this global pandemic, is there any precedent for it in terms of people being able to take some solace in the idea that this has happened before? Things like this have happened before, not in our personal experience necessarily. And also within your profession, has there been any preparation for something like this? We hear about how prepared or not we may have been from a public health standpoint. From a mental health standpoint, is this something you guys think about?
Well, first of all, let me just say that this is unprecedented in our lifetime, in our history. I mean, when folks talk about pandemics and really significant things that have happened, usually we go back even to into 1918 or other kinds of pandemics, that the flu or other things. So honestly, this is a real unprecedented thing that's happened. There are some things that we do know about that in terms of, for example, the kinds of trauma issues that people are experiencing. We've experienced like quarantining or having to come together and really address what can we do when things happen. But ultimately, we really have not experienced anything like this. And so we are learning a little bit as we go and what's happening out there, which is why so many resources have been developed and put together to try to help people, whether they're parenting or whether their own personal mental health is being impacted. So I think that we do know from psychology and other research kinds of studies that what impacts our lives. We also know how to build resilience and how to make things better. And so now we're just having to really pull all of that together so that we can make a difference during this particular unprecedented time.
Very good. Tell me about some of the more common mental health related complaints and issues that you guys are seeing come up this far. We're a good 2 months into this thing now. Sure. And there probably were the initial 2 or 3 week cabin fever has probably passed. Are there different things that are coming up at this particular point in the sequence?
Well, I think that, I mean, and your audience will know this, and we all know this probably in our own families, that significant amounts of anxiety is not an unusual thing to happen. We have whole lots of things to be anxious about. People have lost their jobs. We've had people whose family members have been impacted. There's a lot of grief that has happened, whether because somebody has experienced loss or, loss over events and activities that we have normally been able to experience. Just take a look at, the seniors that are supposed to be graduating or people that are supposed to be taking trips or I mean, yesterday over the weekend, was Mother's Day and people having to social distance or not visit relatives. And so in many ways, we've experienced tremendous amounts of losses on so many different levels. And so, so loss, grief, anxiety, of course, people's feelings of sadness that can lead to a longer kind of depression. Those are things that happen. And I think that we're also seeing folks, reacting in some negative ways around like post-traumatic stress disorder because of the things that are happening to us. We were also concerned, and we've seen the possibility, at least, that that families are struggling, whether it's because of challenges that, together. We've seen a higher rate of things like domestic violence or child abuse kinds of things. We're concerned about people's mental health and worrying that with an experience like this, that maybe people might feel that they would take their own life. And so we have to worry about how folks are feeling and interacting. And that's why we've seen like a number of hotlines that have been created here in Houston and now all over the state. The Hackett Center for Mental Health and IDD has a 24-hour a day, 7-day-a-week hotline where people can call if they're experiencing a challenge, because we want to make sure that people get the support that they need so that they can be okay during this really very difficult time.
Tell me about, let's say, with okay to say the whole mission is to start conversations and foster conversations about mental health. Let's say I personally have never sought out any sort of counseling or any sort of mental health, actual help. Give me some advice in terms of how would I know when I really do need to reach out to someone else? What is that point where someone who has not taken advantage of that opportunity before should maybe think about going ahead and calling somebody?
Well, I mean, first of all, you're not alone. People should know that they're not alone, and that it is okay to say when you're not okay. A recent study showed that about 50% of us across the country are actually now worried about their mental health, which is really interesting because this challenge has given rise to a lot of discussion about mental health, which is important, and it's a good thing. I think that when it becomes a situation that you can't control, when your anxiety is just so out of control that you can't stop yourself from thinking about it, or when you're feeling so sad that you can't get out of bed, or when you find yourself perhaps drinking more than usual, or certainly an excessive amount, or using drugs an excessive amount, that you should know that can be identified as a concern, and that's when we're hoping that people will reach out for help, call the hotline number, call their primary care physician, or if for a child, their pediatrician, and have that conversation with them, because so many folks are struggling, and they don't necessarily know, but significant changes in the way that your eating habits, your sleeping habits, the way in which that you're interacting with others or snapping at others, when it gets to a point where you're worried about yourself, your anger level is just so high, that's when we're really hoping that people will call. Like I said, if you don't already have, if you're one of the folks that are sort of new to experiencing mental health challenges and you don't have a counselor, a psychologist, psychiatrist to call, that's when we really recommend that you talk to your doctor and get a referral, for somebody to help. Right now, Texas, as well as many places across the country, have allowed for mental health services. So, or even telephonic, you can pick up the phone. And so counselors and others are available so that we can actually have those conversations either through Zoom or Skype or FaceTime, or certainly over the telephone, so that people can get the help that they need.
Very good. We'll wrap it up pretty quick here. Dr. Blau, you mentioned earlier that the psychological profession is having to kind of feel its way forward through this situation. Is there anything unusual or surprising to you that you guys have discovered, or any kind of new ideas or thoughts?
Well, I think that, again, we're learning a lot. We're trying to find ways to help people, like online or other strategies. We're doing a lot more connecting. So while we're, quote, social distancing, not a term that that we like because we want for people to stay social, but as they are having to keep healthy spaces, with each other, I think that we want folks to reach out and to continue to have those kinds of interactions. We are worried about people that may be out of a job and are worried about finances, and this may be a good time to focus on improving yourself or taking care of your own self-care, whether it's looking at improving your resume or volunteering your time or addressing some of those issues. For children, it can also be a real challenge because they can't see their friends and they've lost out on stuff, and so we're really recommending that people have these conversations, be open and honest, and ultimately be okay to say that you're having a challenge so that you can get the help that you need.
Very, very good. Dr. Gary Blau, Executive Director of the Hackett Center for Mental Health. Thank you so much. Great conversation. Appreciate it.
Thanks for having me.